He's probably the only one in India who is an expert in this new way to select the remedy. And so, with these words, welcome Dr. Devang Shah.
Thank you. Thank you so much, sir, for this lovely introduction.
So, Devang, you have been learning polarity analysis since many years. You've been practicing also. You have learned it from Heiner Fry, the founder, the creator of this method. Uh, Tell us in a brief, you have spoken about this method earlier also, but just for those people who are not initiated into this, what is polarity analysis?
So, sir, basically, polarity analysis is one of the tools you can say or approach in homeopathy to find a remedy. And it is based on Boni Hussein's therapeutic pocketbook, the repertory which people have literally forgotten and which Dr. Heiner Fry sir has kind of brought to light. And he has added a little, you can say, a shade to it, which is called as polarity analysis, and which is what I will be explaining in the course in detail what it is about, what is polarity analysis. But in short, if I have to give an example, let's say that patient has had cold, cough, and fever, and he gives us the location, sensation, modalities of that particular problem that he is suffering from. And let us take one more symptom in that the patient says that the patient feels thirstless. So in polarity analysis, there are two kind of columns. One is the symptoms of the patient. Let's say he has yellow discharge. It is worse in warm room, better in open, then better by movement, for example. And along with that, the patient says that his thirst for water has decreased along with the onset of the problem. So what polarity analysis does is also takes the symptoms of the patient and simultaneously it will also take the opposite symptom. For example, it will take better in warm room, worse in open air, better by worse by walking, and thirst increased as the opposite pole. And then there will be addition of the symptoms of the patient, that means the modalities that the patient has given, and the opposite pole which is there will be subtraction from the symptoms of the patient, and the resultant between the difference between the two is something that is going to help us to select the remedy. And in this particular case, if we see that the patient is better in the open air, he is better by walking, there is yellowish discharge, and the thirst has decreased. All these will point to pulsatilla. And normally, what happens in our repertorization is that we only get the repertorial totality. Polarity analysis helps to kind of eliminate a certain remedies. So, all the thirsty remedies which come in the repertorization, for example, will be eliminated if we use the polarity analysis. So the search for the remedy from 10 remedies will narrow down to 2 or 3 remedies, and that will help to, kind of come more closer to find the remedy.
So, this is a method of eliminative repertorization,
Yes, yes, sir, you can say that.
where we eliminate the remedies which also cover the polar opposite symptoms.
Yes.
Okay, that's great. I can see the utility because what happens is that when we repertorize a case, the top 10 remedies that we get, especially in chronic cases, uh, they're large rubrics. And what we get is the first 8, 10 remedies, all of them cover the symptoms. And then we sometimes find it difficult to choose the right one amongst them. So if we can use this polarity analysis tool and eliminate the remedies which have strong polar opposite, then we'll probably left with only a handful, 2, 3 remedies from which choosing the correct remedy would be much more easier.
Exactly, sir.
Yeah. So that's something very useful. How has this understanding, how has this knowledge changed your practice?
So when I came to the other song, I was mainly a resident to a lot of senior doctors like Dr. Jayesha sir, Dr. Gajanan sir, Dr. Dinesh Chauhan sir, and Dr. Sachindra sir and Bhavisha ma'am. So our role at that particular time was mainly to, manage the acutes that tend to happen when the patient has been prescribed a chronic remedy by the senior consultants. So my difficulty was whether to repeat the acute remedy, the chronic remedy, or whether to change it. How do I deal with the acutes that come during the chronic case consultation? And that was my biggest challenge. And as a beginner, 10 years back, I used to kind of routinely repeat the constitutional remedy, assuming that the constitutional remedy should take care of the acute. And in some cases, it would help, but in most of the cases, I would not see that the patient is getting the kind of relief that we expect. And that was the time when I was exposed to polarity analysis, and I kind of did my own little statistical evaluation of the cases that I saw. And I found that the percentage of success using polarity analysis in acute was way higher than what I used to get by just repeating the chronic remedy. And that is what changed everything for me, because then the patients started getting faith in me along with the faith that they had in the senior consultants. When senior consultants were busy or they were traveling abroad and they wanted to refer their known people, they had the confidence that they can trust in me and my abilities to take the cases. And that is how my practice kind of started building, and that made a huge difference in my practice. And normally homeopathy is not really known to treat acutes. People feel that it's only for chronic slow lingering problems, not for acute cold and cough. But in fact, what I see is the reverse. My percentage success is much more higher in acutes than in chronics.
But what has been the results like in chronic cases?
So in chronic cases, I have not really studied statistically the way I studied for the acutes. Like for example, in acutes, I kind of over a period of 2 years, I was following up around 300 cases, and I had my own criteria for success and failure. And in that, I could see that around 79% I was successful. In chronic, I've not made such a study, but I can say around 50 to 60% cases do well using polarity analysis.
So you see a difference in your chronic cases also before polarity analysis and after polarity analysis.
Absolutely, absolutely.
Hmm.
Because polarity analysis kind of gives me a confidence to take up any case. If it was not for polarity analysis, I would be really uh, anxious and worried to take up the COVID cases which happened, because there are so many questions that a beginner would feel that what questions to ask, what symptoms to take, which repertory to repertorize, what potency to take, how much repetition is needed. And all these questions were answered for me when I studied polarity analysis. And I felt that it is very easy and it is very effective. And most importantly, it is very consistent in its results.
How long does it take for one to learn the basics of polarity analysis?
If you really ask me, I had attended only that one seminar, and then I ordered Sir's book, and then I got interested in reading and understanding it. So if you see around, you can invest 20 to 24 hours of thoroughly understanding the concept. Then you can solve majority of a general practice that happens in most of our India.
So you are going to teach at Master Homeopathy Academy a course on polarity analysis and rheumatology. What exactly are you going to teach in this course?
So, sir, there will be 4 sessions. In the first session, I'm going to go through the basics, like what is polarity analysis, what are the important aspects of polarity analysis, like which repertory it is based on, then what are the polar symptoms, then what is a reserve remedy, then what is a contradiction of a remedy, how is polarity analysis calculated through different cases. Then in the next 3 cases, in the second one, I might take up cases which are kind of very difficult, where the patient will give more symptoms or patient will give less symptoms. Then how to use polarity analysis in such cases through rheumatological case examples. Then in the next two sessions, I will be going through cases like fibromyalgia, carpal tunnel syndrome, rheumatoid arthritis. I have one case of lumbar canal stenosis, which is being helped by polarity analysis. Then some cases of frozen shoulder, which are doing really well using polarity analysis. So multiple rheumatological or musculoskeletal problems that a practitioner faces in their day-to-day practice, and how they will be able to use this technique by just attending this 4 sessions is what I'm going to focus on.
So the idea is that you teach the basics of polarity analysis so that anybody who has not used it before can actually start using it right from the class one.
Yes, absolutely. In fact, after the first session, they should feel confident to take up any case, not just rheumatological case. It could be a fever case, it could be an acidity, migraine, back pain, neck pain, any case that comes, they should be able to take. Also, I will be touching something upon limitations. This approach also has some limitations. So I will also share that aspect.
So we can use this approach for acute cases as well as chronic cases and chronic cases of all kinds. But in this course, you will be dealing with a lot of rheumatological cases. Rheumatological cases are often a challenge in our practice, not easy to treat, especially if there is a lot of pathological change involved. So it would be good to see your results, and I'm sure anybody who is going to see those cases will have a lot more confidence in their own abilities as a homeopath, in their homeopathic remedies, and will feel empowered with the with this additional tool in their pocket to solve difficult pathological cases.
Absolutely. In fact, the biggest change that this method has done to me, it has given me confidence. You bring any case, it is not that I am going to be anxious or worried about, because I know that I have something which is very useful. And if it is used in the right way, there is a huge 80% chance that the patient should feel better. So that is the biggest gain that I have got. And it is so simple, which is what I'm going to demonstrate.
I love this. So let's spread this confidence.
Yes,
I would love to have more young students and even experienced homeopaths to exude this kind of confidence that any case, let it come, we can handle it.
yes,
So
absolutely.
it's a useful tool. Let's teach this tool to more students, more young practitioners, more seasoned practitioners. Everybody needs more tools in their armor. And I'm looking forward to your classes.
Yes, thank you. Thank you for this opportunity, sir. And I am really, I can feel the change in the confidence after I attended that workshop. And then I had an opportunity also. Sir was very kind to, have me at his clinic. And I saw actually that he sees around 40 patients, 20 in the morning half, 20 in the second half. And I saw the results, what is being published in the book, and what is actually happening in practice. It does not take more than 15 minutes for him for a new case or for a acute case to solve. And it is just wonderful to see it work.
So that's so powerful. If Heiner Fry is seeing 40 patients in a day and he's able to solve difficult cases in 15 minutes, that's a wonderful tool to learn.
Yes, absolutely, sir.
So great, Devang. We look forward to this course, and I urge anybody, everybody who is listening to this, watching this, to join the course. You can find the details on the next screen, on the end screen of this video, and also and in the description and comments below. So do click in and join the course. It's a one of its kind opportunity where you're going to learn it directly from one of the leading exponents of polarity analysis, our dear friend Devang Shah. And so don't miss this opportunity. Thank you, Devang. Thank you so much.
Thank you so much, sir.